Hi, I'm Dr. Ted and this is Fracture Friday. For this episode, I have a periprosthetic supracondylar distal femur fracture. So this APX right here is what I just said, a periprosthetic supracondylar distal femur fracture. So what does all that mean? So let me show you the lateral. So this is the lateral. Okay. So these last two x-rays are a periprosthetic, which in medical terms means that it's around a prosthesis. So on the x-ray you can see that the patient's already had a total knee placed. So that makes it somewhat difficult. We've talked about these on episodes before about how if there's a prosthesis in there, it makes fixing the fracture more difficult because of the metal from the prosthesis and the limitations in regards to how we can put hardware in there. Okay, so periprosthetic around the prosthesis, supracondylar, which means it's above the condyles of the femur. You may have to just Google that. The distal femur kind of flares out and there's a medial and lateral condyle, and this is above that. Okay, so and distal means at the end of the bone, and it's the femur, which is your thigh bone. Okay, so what do we do to treat this? Alright, so this is the AP post-op x-ray. We put a lateral distal femoral plate. Okay, now this is a severely comminuted fracture, so it's also what we would call a bridge plate because there's a large gap between the screws in the distal end of the plate, and then there's the fracture, and then all the screws in the top end of the plate that hold the fracture together. Hope you enjoyed this episode. Stick around. Hi, Dr. Ted. Thanks for sticking around after the video. If you'd like to see some more content from us, please subscribe to the channel and like this video.